Watching the Doc Talk Show.
Thank you for watching the Doc Talk Show. I have had an amazing evening. I have learned so much, yeah, but I've also discovered that, there is so much we can do with limited resources, yeah? But I think one thing that is so special about what Andrew is doing is that he's using personal resources, investment of time, investment of money, to actually do a lot of work in the community. The work that he's doing is saving many people's lives and is bringing about transformation. And I am curious to know, because for a very, very long time, I have wanted to do some form of community work. I have actually worked in a health center before in Tororo district. And we used to do community outreaches and things like that. But our community outreaches were actually financed by the PHC funds, but also the project that I was working with. So I never really had to invest personal finances to do that work. But I have also had this desire of doing community work, especially in the community where I come from, where we do not have access to a medical clinical officer, because at a parish level, we usually have a health center too, and a health center too just has a nurse or a midwife and maternity services and some outpatient services, really. So I'm inquisitive. Why did you start this work? Like, what motivates you and what keeps you going?
Thank you very much, Doctor. Actually, about two major things. Those ones that, like Doctor said, that encouraged me to begin what I'm doing, and then what keeps me going. So in the beginning, it started with my life personally. I come from a background that is not doing well, from a poor background and a poor community in Manafa. So it started from the beginning of my life when I was born, because of limited resources and maybe partly due to ignorance. I was produced from the traditional birth attendant, who was a certain old person who was known for delivering or performing deliveries. So she could use maybe like one razor blade on several people during that time, because they were not all that available. So what happened is that she cut my umbilical cord with a rusted like razor blade, which caused the severe cord sepsis, and they said that I almost died because it complicated to sepsis and septicemia. So another thing is, when I survived that, I grew up and I became a victim of false teeth.
False teeth removal.
What they call a rhino. That practice, many people do it in the village. They tend to extract those buds, which was where the teeth will grow in future, maybe the canine. So they tend to protrude, and people will think it is those teeth that is causing the problem when a child is having diarrhea and fever. So I happened to be the victim, and they took me and they removed them, which we know that they don't exist. So when they removed, it complicated, and I ended up with the malalignment of the teeth, which thank God they helped correct when I was still in primary 7. So it didn't have to affect me at this old age, but it affected my look at that time because it was protruding. But the problem was because they tampered with the teeth when they were just trying, when they were just trying to grow. So that motivated me to want to do something about it. And then another thing is the things that I have seen when I was in the community, when I could fall sick. You could experience like all the signs and symptoms of a disease, because you don't have money at that time to buy the medication, or sometimes when they give you medication, they do self-medication, they give you wrong medicine.
And you can sometimes take half doses.
Yes, sometimes half doses. So that suffering encouraged me to want to do something to tell people about the dangers of self-medication. treating people from home, and then to try to tell people about the dangers of extracting the teeth or delivering from home.
Yeah.
So that is what motivated me to begin this program. And then what motivates me now
to keep going
is the success that we've attained.
Wow.
Despite of the few challenges that we have, but the success that we've attained in a very short time is just exciting.
Yeah.
It is exciting. We've seen that there is a girl in Mbale district who is 3 years old and was staying with the grandmother. So this girl had jaundice, that yellowish coloring of the white part of the eye.
Yeah.
So the grandmother thought that the grandchild has been bewitched. So they kept moving the child from one witch doctor to another. Yeah, so because people have heard about what I do, so someone sent me the pics
of
that child. And I had to go to Mbale district. I found, when I've done some investigations, I think from a clinic, which I don't know, but they had thought that it was the problem, which was maybe due to obstructive jaundice.
Yeah.
So I had to take that child. I convinced the grandmother, and I took that child to the pediatrician in a hospital for government, that is in Alfenya. I think it is in Ginger. So
wow.
The pediatrician asked to perform some investigation somewhere from outside. We got some money, we went and performed them, and then some were performed inside the hospital.
Yeah.
And they were able to diagnose the child with sickle cell, and we started that child on treatment. We've been also able to get her a cup of milk every day.
Wow.
Yeah, from a local shop. I bought, I pay for her. So I recommended that we put her on that milk at least like for 1 year, which I have already covered.
Wow.
The child has started improving on medication, no longer has those
painful
attacks,
crises,
crises, and their life has improved.
Wow.
And then another boy was a boy who had a fracture. That boy was also staying with the grandmother. That one is in Mbale. He got a fracture and they didn't manage it well, so he ended up with chronic osteomyelitis.
Yeah.
The child had spent about 3 years without going to school, and the pus was coming from the wounds because the bone was rotten. So I had to work with the surgeon in Mbale Regional Referral Hospital, and he started guiding me. We started putting the child on a balanced diet, on antibiotics, and we started treating that child. Right now the pus stopped coming, can play with friends, and is now at school studying. So those stories, the happiness that I see in the faces that we've improved, it keeps me going.
Very true. Just listening to those amazing stories, I just want to begin tomorrow,
Yes.
And I am really, really excited for you. People's lives are being transformed, and every time you transform a life, there is opportunity to transform community, and as a result, the world. I really, 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 really applaud you for that. We are coming to the end of our show, and honestly, I would want your community approach in every community in Uganda, because I know with our doctor to patient ratio that is currently standing at 0.2 per 1,000 Ugandans. We need healthcare workers at the grassroots serving, because also it is important to know that more than 75% of Ugandans do not stay in urban centers where majority of the doctors are. They are concentrated in the rural areas. So what are the plans for the future? Are you going to come to Chai? Are you going to go to Masaka? Are you going to go to Arua? What plans do you have for the future? Because honestly, the work that you're doing with limited resources, if we scaled it up, we would be able to serve very many Ugandans?
Yeah, so the plans that I have for the community is to make sure that I improve the community further.
Yeah.
And when I talk about the community, it is not only the people.
Yeah.
I'm looking at the environment and I'm looking at animal welfare as well.
Wow.
So I'm looking at improving the whole community starting from Eastern Uganda, and then I spread the whole of the country.
So we are going to see multiplication.
Yes,
Yay!
multiplication.
Wonderful.
I don't know how long it will take, but as long as God lends me breath, I will continue doing that and see where God will enable us to reach. But the plan is to make sure that we have more people planting nutritious seedlings.
Yeah.
I already bought one piece of land for making nursery beds, such that I can be able to supply enough seedlings, because I just used to buy.
You're incredible.
Then, yes. So I have the land near the water for making nursery beds. And then I also bought another land where I'm just going to put fruits. It's 1 acre. Such that I will be supplying those fruits to people who are sick. I also bought another land which is 1 acre. That one I've designed it to be for the hospital.
Wow.
Because in most cases, we work on these people in the community, but then when we refer them to the hospital because of lack of finances, they end up
they
not
don't
going.
want to go through.
So we want to capture those people in that hospital.
Okay.
So the land is already there, and next year I'm hoping to begin bricklaying.
How can we support you? How can we support you? How can policy makers come on board? How do people who are responsible for budgets come on board to support you? Because what you're doing is so incredible, and the fact that you already have results, we can scale this up.
So first of all, my request is to everyone who is watching me, whether a Ugandan or a non-Ugandan, is to start by changing our hearts. To start looking at human beings as our fellow human beings, that not look at them just as someone you are going to use to make money, most especially when you are a health worker, but to look at that person as like someone who is going to give you an opportunity to serve.
True.
Because that is like a calling from God to serve those people. So I request that we first relax about money. We need money, but let's not have too much pressure. Because when we have too much pressure, then we end up doing the wrong thing. So that is the first thing. Another thing, I would like the existing NGOs and the government to make sure that they increase the funding of the health sector. Like you mentioned that less than 10% of the budget is allocated for the